Whether or not to take an immunization is very controversial, and many patients and their families are learning to question whether or not an immunization is appropriate, and some of them are refusing to have immunizations. It is interesting that by the time a child reaches the age of 18, it's not infrequent that they'll get as many as 60 vaccines, so it's not like this is a small thing. And a lot of the things that are in the vaccines are not necessarily things that we want in us, like the thimerosal, which has mercury in it, or the formaldehyde, or some of the DNA fragments, or the live viruses, or the fragments of viruses that can be in there, plus other toxic things like adjuvants. So it's a fair question. There are about 20 to 30% of pediatricians in a survey that was carried out across the U.S. that actually had fired patients who would refuse to take their immunizations. And I find that interesting because, you know, it's kind of naive and arrogant to take a position when you haven't studied it personally yourself and you're simply following the rules that are established by the CDC, who I don't trust. And if you want to learn more about my experience with the FDA and with the CDC, you can go to the website drsaputo.com and put in the infection deception, which is an amazing expose of what happened when the swine flu vaccine came out. And I report all the things that went into making it the debacle that it is. But in any case, a lot of pediatricians are just taking the word of the CDC and of the American College of Pediatrics and assuming that immunizations are something that we all should be doing and taking them all on a regular basis. It also takes people's power away from them. So we have individuals who have thought through this problem of whether or not an immunization is one they want to give to themselves and their family, including their children, or not. And we need a level playing field so that we can have roundtable discussions to actually look at the data before we decide that this is something that we do or don't want to do. A case that comes to mind, I have a patient who has autism that's in the range of, must be 17 years old now. And the mother knows a lot about autism and what causes it, and has done her own research and has worked with the top individuals in autism research in the world. So she's pretty aware of what the story is there. She happens to believe that immunizations caused her son's problem with autism. Her pediatrician sent her a note and said, if you won't have your son take these immunizations that he's due to have, I'm going to discharge him as my patient from being in my practice. The mother came to me and said, what do I do? I wrote the doctor a letter saying, you know, the mother has a problem accepting that autism is something that's not related to the immunizations because she noticed a change in her child after immunizations. Whether it's true or not, I think that there's a place where you have to listen to your patient. And that's where the art of medicine comes in, of deciding whether or not something is really a solid piece of information or if it's something that a person has an opinion about that might be different than the mainstream. And the question is, should it be respected? I think that medical care should be a collaboration between the doctor and the patient. And what's right for one person is not right for another. And the art depends on your being able to listen, to care, and to work situations out that make the most sense for the situation. I ask the question when it comes to immunizations, where's the data? Particularly when you're looking at something like the immunizations for influenza virus, and particularly the swine flu vaccine. Why don't we just put all these questions to rest by doing one simple study? All we have to do is immunize one population, not immunize another population, follow them for 2 or 3 years, and see what happened. Did the group that was getting the immunization fare better from the point of view of not coming down with the infection? How about the group that didn't take the immunization? Were the infection rates or the mortality rates any different? And how about side effects? Were the same side effects that are seen with the vaccine seen in the people who didn't take the immunization? That's a simple study, and it should be so easy to do. And I question why it's never been funded by the FDA, or excuse me, by the National Institutes of Health, to come out with a study that answers that. Most of the time, the answer that I've heard is it's not ethical to withhold a vaccine from somebody. And my position is it's not ethical to give them immunizations until you've done the study. Now we've got a problem. So what do we do with the pediatrician or the family that says, I don't want to take this immunization because I don't think it's the best thing for my child. And the answer is you've got to work things out with the pediatrician. And the pediatrician has to be open-minded if he's going to really be giving true health care, as opposed to just care that's in some brochure that's put out by the CDC that says these are the things we recommend in general for all kids. So should a pediatrician fire a patient who refuses immunizations? Well, if they do, I think that the parent and the child are better off with a different pediatrician. So it's as simple as that. We've got to work out a way to do better data that gives us better information. I'm not opposed to immunizations. I'm actually for them. But I like to see the data first that shows that, one, they work, and second, that they're safe.